If you were morbidly obese and could lose 100 pounds or more in a year, wouldn't you? Bariatric surgery, specifically gastric bypass surgery, is a proven way not only to lose weight, but with the right lifestyle changes to keep the weight off. As with any life-altering event, this surgery can cause a lot of controversy. There are many people who believe that you shouldn't risk a major surgery just to lose weight. They believe that people who are overweight should be able to control their diet and exercise and lose the weight on their own. But for me, 2 of my best friends, and many other people, we've decided that the risk is far outweighed by the reward: a happier, slimmer life. Today we're going to discuss what exactly gastric bypass is, what the lifestyle changes that you need to make after the surgery, what the risks of the surgery really are, and my decision to have the surgery. First, we're going to discuss what gastric bypass surgery is. Gastric bypass surgery, specifically Roux-en-Y gastric bypass, is a laparoscopic procedure that lasts approximately 45 minutes. According to the Mayo Clinic, gastric bypass is the most common bariatric surgery that's done in the United States. During Roux-en-Y gastric bypass surgery, the surgeon will make 5 to 7 incisions along the stomach, which he will use to cut off a small section of the stomach. This small section of the stomach will then be made into a pouch. The pouch will be attached to the small intestine and bypass the rest of the stomach. By rerouting the stomach system, the food that we eat spends less time in the body. Therefore, the body has less of a chance to absorb the fats that cause us to gain weight. Therefore, this will increase our weight loss. If you look at this diagram right here, this is a normal stomach before the surgery, and then this is after the surgery where there's a smaller spot, and then it's bypassing the rest of the stomach completely. The doctors say that the rest of the stomach still stays in there and has blood flow and produces gastric juices just like it would if it was still having food pass through it. It's just bypassed. Weight loss surgery is an amazing tool, but it's not something that can happen without lifestyle changes. During the process for me to be approved for my speech, one of the requirements that I had was to attend 3 speeches at Georgetown Community Hospital given by Dr. Sonnenstein. During these speeches, he talked about what life would be like after gastric bypass surgery. One of the things he talked about was our stomach size. The stomach size is now 5 to 6 ounces maximum, so we're required to have 3 meals a day, 3 to 5 ounces, and 2 snacks that are 1 to 2 ounces. Along with the smaller meals, we also have to learn to prioritize what we eat. Because we're taking in less overall throughout the day, we need to concentrate first on protein to make sure that we're getting in enough throughout the day. Our goal is to get in 70 grams of protein. That's how much a normal person would get in almost in 1 meal. Another change that we have to get used to is vitamins. We have a vitamin regimen that includes us taking a multivitamin, vitamin B1, B12, calcium, vitamin C, and iron. I know that sounds like a lot of vitamins, but once you're on the vitamin regimen itself, it actually only takes like a minute a day to take these pills, and it gives you everything that you don't get in the malabsorption because of your smaller stomach. Another lifestyle change is exercise. Through exercise, we're able to not only increase our weight loss, but the more weight we have to lose, the more skin that's possible that we have on us, and the more we exercise, the more chance it has to tighten on its own without having to have any kind of surgery following the gastric bypass to have skin removal. I know that people believe that you shouldn't have gastric bypass surgery because it's a risk, but there is actually not a lot of risk involved in this surgery. Only 10% of gastric bypass patients have minor complications. Minor complications are wound infections and digestive problems. Digestive problems would be, there's a thing called dumping. If you eat too much sugar or fat quickly, it'll run through you quickly, and when it hits your bowels, it'll make you really ill and have diarrhea. Another thing you have to be careful of is if you eat too quickly, sometimes it'll stop at the top and you'll throw up. But for me, these are just small prices to pay if I had these along the way for the choices that I've made. Only 1 to 2 people who've had gastric bypass surgery have serious complications. Serious complications include blood clots and stomach leakage. This also includes death, but death is actually only like 0.5% of gastric bypass patients have ever died from the surgery. One of the reasons that I am so for this surgery is because I myself have had it. I have struggled with weight my entire life. When about 18 months ago, I finally made the decision to have this surgery. It wasn't an easy decision for me because, like so many other people, I thought that surgery was me cheating my way to a thinner, healthier life. But after so much struggling and thinking about it, I just had to decide that it was the best thing for me to do at that time. So I've started the process. I know many people think that once you start the process, you decide you're having it one day and the next day you have it. But the truth is that it's a long, drawn-out process that gives you plenty of time to think and all the information that you could possibly need to make an educated decision before the day you have your surgery. My process ended up taking about 10 months, during which I had to have psychiatric evaluation, psychiatric testing, group sessions, group therapy sessions, as well as meetings with dietitians about food and exercise after the surgery, as well as attend Dr. Sonnenstein's lectures about what life would be like afterwards and what I can expect. In the last 5.5 months since I've had my surgery, I've lost 61 pounds. During that time, I've experienced none of the complications that 10% of gastric bypass patients experience. I've had a wonderful experience that I am grateful for every day, because I am not only happier with my life, but I'm healthier, and I feel like this was the best choice that I could have possibly made. I know that many people will listen to this speech and about what gastric bypass surgery is, the life changes that need to be made, and how small they really are, and how tiny the risks are with the surgery, and still believe that any surgery is too big of a risk just to lose weight. But I hope after listening to me tonight that all of you will also agree that in this case, surgery is the best option, because it gives people who are obese a chance to lead happy, healthier lives.